Hi everyone, and welcome to another segment of the DL. So what I want to talk to you about today is what to do right when an injury occurs. So we're all pretty familiar with getting injured, unfortunately, and the standard protocol is, there for a reason, tried and trusted. But there are a few things that you can also do just to help identify the injury to your doctor and kind of be more educated as far as treatment and getting everything rolling a little bit sooner. So the first thing we all know, best advice ever, is RICE, rest, ice, compression, elevation. As soon as that injury happens, you stop what you're doing, put some ice on there, wrap it in an ACE bandage, elevate it above your heart. So if it's your foot, not necessarily above your heart, that's really for upper extremity, but elevate it so that blood is draining, right? Instead of going towards the area, because that's going to increase inflammation. But aside from RICE, what is really important is making sure you take note as to what you were doing when this injury happened. So if you're a soccer player and you hurt your knee and you say, okay, I was moving laterally and it was my left leg that buckled to the right, then it's important to remember that, because that can help diagnostically kind of eliminate, okay, it might not be this tendon, it might be your ACL as opposed to your MCL. So just remembering those things can really help when you call a doctor and explain the injury, especially if you can't get in to see a doctor right away. Knowing those things can kind of give a very small preliminary diagnosis so that you're not going to maybe make the injury worse while you're waiting to see the doctor. So again, just really being aware of what you were doing when the injury happened. If you were a dancer and you were coming down from a jump and you landed badly on your ankle, did your ankle invert or did it evert? Because that can really determine which side of the ankle we're looking at to diagnose the injury as well. And paying attention to your nutrition when you get injured is very important. Making sure you're getting your vitamins, minerals, proteins, so that any tissues that were damaged, really repairing them. And finally, just looking to see if bruising or inflammation is happening right away. That can be indicative of the severity of the injury. So you might sprain your ankle, and depending on the grade of the sprain, so if it could be a more minor sprain, you might not see extreme bruising or inflammation right away, and that is actually a good sign that can help diagnose the grade of the sprain. But if you see a bruise occurring within 10 minutes of the sprain, that can be pretty serious and it needs to be looked at as soon as possible. So just keeping an eye on kind of what's happening there. So those are really just some little things you can do when you get injured to kind of get the ball rolling with your physician and really getting the diagnostic process hopefully shortened so that you can start your treatment process as soon as possible. So hope that helped you guys out, and have a good one.